You know, you always feel like you have control over your life, but in reality, you really don't, ever.
I'm one of those people who is in control of my life. I do my own schedule. I don't have a secretary. Everything is on me, and then that's what I do. You know, these sorts of things are just out of your control. That's what happened. I didn't have control. My name is Stephen Fay. I live here in Wayland, Massachusetts. There's no history of heart issues in my family. I don't smoke. You know, I exercise. I'm Gloria Clow, and I'm a member of the board of directors at Emerson Hospital. And I also was a patient. I tried thinking I was doing well enough, but you know, these were just the cards I had. It didn't just start on a day. It started a couple of weeks before. I exercised a lot, I walked, and as I was walking, I felt a burning sensation in my jaws. I went out for my cool down walk, and it's a 2-mile loop around the neighborhood that I do almost every day. Moments later, my wife Diane came home and saw me, was somewhat struck as to what I was doing home. She kind of touched my shoulder and said, "What's the matter?" And it actually hurt.
I got a call from the emergency room that Mr. Fay had been admitted to the hospitalist service here at Emerson with chest pain.
So Gloria called the office having some symptoms that someone had suggested maybe she needed to see a cardiologist.
I went to him and I said, I don't think it's my heart, but. So
I was fairly convinced she had coronary disease from our first interaction.
They took me in. By the time I sat down there, I pretty much collapsed at check-in.
We admitted him to the monitoring floor, the telemetry floor at Emerson. But I think the fact that he lived closer here than people may do to a hospital in Boston, I think only highlights the need for a good community hospital that can take care of people with heart problems. I was very scared. And it's something that happens to somebody else, not you.
Long and short, I had a heart attack. And it was pretty frightening.
She was a little reluctant to believe that she had coronary disease, so she did take some convincing as far as needing to have a stress test and then eventually needing to have a cardiac catheterization.
They admitted me, and then a day later they took me to have the cardiac cath to have the stent put in. Dr. Dottie came in and pretty much laid out what was necessary, what had happened.
And so at that time, I recommended to him, after speaking with one of my colleagues at Mass General Hospital, that we transfer him there immediately.
We put her in an ambulance. They took her straight to the cath lab. I was able to meet her at the cath lab, perform her procedure, and then found out she needed bypass surgery.
I literally just wanted to get this done and over and get back to normal.
Coming back home and needing to get back to Emerson and some of the care and the follow-up procedures that needed to happen, they made me aware of the rehab program.
There is some advantage to being in a community hospital where you get to see the doctor that you know and your doctor's available and you're not getting referred to a resident or a fellow or somebody who's in their training, but you're getting to see the attending physician who knows you well.
I came back to my doctor, Dr. Tillinger, and he was my cardiologist, and he followed me and helped me.
And I think it's important that we're close by, that she can either call me in my office and she knows she's going to talk to me or my partner, and to know that throughout the process I'm going to be there for them, I'm going to help them through it, and that even afterward we're going to continue to take care of them and make sure they recover well.
Once you have a heart attack, I mean, it's the wake-up call, and you can either deal with it and on an ongoing basis for the rest of your life, or some people don't have a second chance. So I gained that from him.
I tend to think that there's a lot of value in having good clinical cardiologists in the trenches, in the community. I don't think we ever are able to tell someone with certainty this will never happen again, but I think he would offer himself the best chance to make this just a one-time occurrence for him, which is all you can really hope for patients.
I would actually say that's one of the most rewarding things in medicine, is to see a patient through a serious illness and get them through it to the other side to where they're feeling well, so that over time there is both a patient-doctor relationship, but there's also somewhat of a friend relationship.
There are a lot of special people that work out of Emerson and the rehab center that have the experience to help a lot of people that are in a bad place.
And I feel very fortunate. that it came through, and I'm feeling great.
I couldn't think of a better choice of having landed here in this community that's serviced by Emerson. We're very, very fortunate, very fortunate.